Welcome, I'm Larry Menti. This is Jersey Matters. If you have a son or a daughter who is a student athlete, or if you are a student athlete yourself, you're going to want to pay attention to this next segment. There have been some awful stories across the country that have made national headlines of high school athletes collapsing on the practice field, on the playing field. Many times their condition was fatal. There is a new program in New Jersey that allows you to get testing for a student athlete to prevent a horrible situation. And to talk more about that is Diana Toto, who is the program director at the Matthew J. Morahan III Health Assessment Center. This is a mouthful. The Health Assessment Center for Athletes. So talk about the screening you're offering.
Absolutely. So our screening process is very thorough. Our center actually offers both cardiac and concussion screenings, and the screening, each screening is specific to age. So we start as young as age 6 for cardiac and as young as age 10 for concussion. And our screenings are done throughout all of our Barnabas Health affiliates, starting with Monmouth Medical Center, which is probably closest to here at Monmouth University, but all the way down to Toms River and Community Medical Center, and then all the way up north to Jersey City Medical Center. So we actually have 7 sites where we offer these community screenings statewide.
Yeah, the thing is that, you know, you hear about these stories, and I've read them in Sports Illustrated, you read about them in the New York Times, and these awful situations where these student athletes don't realize they have a condition. And they go out and they practice, and they have tension and stress and adrenaline going, and sometimes that gets to be too much in their heart. And you wouldn't think, by looking at these athletes as the problem, that they would have a problem. But what you're finding is that it's a problem that may go undetected before it's too late.
Yeah, and that really is the truth. I mean, when you look at some of these athletes, they're in shape, they typically look very healthy. Some of these kids have absolutely no cardiac symptoms, which is also scary because we may not necessarily know by asking them questions if their heart is okay. So it's extremely important to really do this additional testing, which is a basic 12-lead EKG, and it's really a 5-minute little quick assessment and snapshot of your heart. So it's non-invasive, it doesn't take a lot of time, and you can find that one child that has some kind of pre-existing issue.
And we should point out, since you just said that coming in up on our next segment, we have a child that the pre-screening may have saved. It definitely helped, and because of it, his brother's here too, because they did screening for his brother as well, and it found out his brother also had a problem. So that's coming up in the next segment. But what does the EKG tell you? What can it show about the heart, and does it tell the whole artery system or just the heart?
Well, what it looks at is it looks at electrical conduction in the heart, and any abnormalities that may be going on that we can't see by just doing a simple physical. So the #1 cause of sudden cardiac death in athletes is hypertrophic cardiomyopathy, which is an enlarged heart muscle. That's one of the #1 things we're screening for. The gentleman that you're referring to that we screened through our program actually had an electrical conduction issue in his heart, so that was picked up on the EKG.
And what does that mean exactly?
So the heart basically, it fires impulses and beats regularly, and things can throw off the regular heartbeat and cause a child to drop and go into a fatal arrhythmia. So when you hear about CPR and AEDs and reviving a child, it's because something caused their heart to go into an arrhythmia where they couldn't breathe correctly. So
when someone comes in, and let's just say this young man that we're talking about that we're going to meet in the next segment, he comes in and you find something wrong, is his athletic career over?
Absolutely not, no. And what happens is the EKG is not covered through a basic sports physical, so that's why it's not part of the physical process. So you come and you can get a free EKG screening with us or cardiac screening, and if something is found, we can help facilitate, or the pediatrician helps facilitate, making sure this child gets follow-up. So if something is found, the insurance will cover the follow-up at that point, and a child may get an echocardiogram or something that will look at the heart's chambers or additional testing. So we kind of proactively start the steps to make sure that they have full evaluation of what they need checked out.
And how do people, I know there's a lot of parents right now that are hearing about this for the first time and would love to get involved, and probably the student athletes who are also would love to get checked out. How do they go about finding you?
So our website actually is barnabashealth.org/Morahan, Morahan. And that always has our upcoming screenings for the season. So across the Barnabas Health system, we have statewide programs that are offered on a Saturday morning from 8 to 12. You should see the rush at 8 a.m. when the kids are all trying to get in before their games. But a lot of our screenings do fill up, and they can register by emailing our team link at Barnabas Health.
Do you reach out to the schools themselves and say, you know, this is available, please come?
We do. We've actually established excellent relationships with a lot of the schools, and the gentleman that you're going to be bringing on later is from Walt High School, which is very local to Monmouth Medical Center. So the relationships between the hospitals and the local schools has kind of grown through our efforts, not only through the screening, but also we do a lot of education for them as well.
Well, let's bring them on now.
Okay.
We're going to take a break, and we'll come back with the two young men who your screenings helped. Thank you very much. This is Diana Toto, the Program Director of the Matthew J. Morahan III Health Assessment Center for Athletes. When we come back, two of those athletes who may have been saved by this program, when Jersey Matters continues.